Well, to further deepen this conversation about medical negligence in Nigeria, the chairman, Medical Jurisprudence Committee of the Nigerian Medical Association, Dr. Olayinka Atilola, joins us now for this. Thank you so much, Doctor, for joining us.
Thank you very much, and thank you for inviting me.
Well, let me begin by asking you, first, your thoughts on the public inquiry by the Consumer Protection Commission, which just concluded yesterday. It was a 2-day inquiry. How effective do you think that this inquiry will be in determining possible violations of patient or consumer rights in the matter of Peju and, of course, Ms. Omojowoyo? Or was it an exercise in futility?
Well, thank you very much. Firstly, I want to convey the condolences of the Nigerian Medical Association, particularly the Lagos State branch, to the family of the deceased, which we have done in person, and I'm still saying that on this program. But having said that, I think there are a few issues we should examine here. If the intendment of the FCCPC is to determine whether a consumer right has been breached, to that extent, they can. However, healthcare service has its own peculiarities, and there is a reason why there is another agency that regulates and superintend, if you will, over the processes and the certification as well as maintenance of quality control within the sector. It's because the sector has its peculiarities. The first thing we want to determine is whether the rights to life, for instance, of the deceased was wrongfully taken, meaning that is there an error in the course of attending to the patient. And the determination of whether there is an error or not in the course of management of a patient is not within the purview of the FCCPC. Granted that FCCPC can determine whether there is a breach of the right of a client to the extent of, I give the instance of, I paid for surgery and that surgery was not done. Okay, so we don't need any inquiry about that. Or that an hospital engages in unfair competition practices, making mergers and acquisitions to the extent of wanting to force other hospitals out of the market. Yes, that is an unfair competition, and FCCPC can have a space there. To the extent that an hospital probably runs, say, ambulance services, and somebody paid for the ambulance services and was not satisfied with the quality of the ambulance service, okay, maybe. However, when it comes to determination whether a healthcare service, the outcome of an healthcare service is a fair outcome or a natural outcome, that fall within the purview of the Medical and Dental Council of Nigeria. And so this is not a system that is left unattended. There is a Medical and Dental Council of Nigeria that is charged with this responsibility. And if there is any role for FCCPC, because when I read through the act that established FPCC, there is a statement that says in Section 17P that the council will encourage trade, industry, and professional associations to develop and enforce in their various fields quality standards designed to safeguard the interests of the customer. So to this extent, if the FCCPC is concerned about the quality of service that may be rendered in the Nigerian healthcare industry, they know who to engage and they know who to seek cooperation from, and not exactly dabbling into the arena of medical practice. I'm not saying that they are not doing their job. In fact, from information that I gathered, the FCPCC under the current leadership has actually been above par. However, on this one, this is one arena that they have dabbled into that is not part of their calling.
Okay, Dr. Olayinka, I know you're not, it's good you clarified that, but I know you're not saying that doctors can't appear in other public hearings other than under the jurisdiction of the regulatory body, the MCDN. Because we know we've seen doctors appear in cases of negligence in court. Can you help us understand some of the peculiarities you speak of? Because we know that the doctors were at hand to speak on the first day of the public hearing, and then they were called away. What is it that would have been so wrong in those doctors giving evidence in public to bolster public confidence, for example?
So, like I said earlier, that from the understanding of the peculiarities of healthcare service, the Medical and Dental Practitioner Tribunal that is within the purview of the MDCN recognize the fact that if we must make inquiry, we'll ask questions and information will be divulged. But then those information is being divulged within a loop of secrecy. For instance, there is a provision in the Medical Code of Ethics that requires that a medical doctor will not divulge information about the ailment, the treatment, the complications or otherwise that the patient may develop while under their care. In fact, that is the reason why people tell the doctor everything. And the oath is that I will not divulge that to a third party, even under threat, even under compulsion, except, of course, if there is a medical panel during which the information is being divulged to another set of people bound by the same oath, or if I'm compelled by a court. And even when you are compelled by a court, the oath requires that you still give the most minimal information and under protest that I'm doing this against my ethics. And the panel that sat in Ikeja in the last couple of days is not in any way a court of law, neither is it a medical panel.
Okay.
So the appearance of Premier Hospital, I'm not privy to it, but it may be that they appear there to the extent of going there to go and state these facts. But eventually they pulled out because Medical and Dental Council continue to remind them that on issues like this, you are bound by oath. Even if the only person that can waive that is the individual involved, which is the deceased, and again for a clearly stated purpose. So these are issues that the FCCPC need to be aware of.
All right. So I have a clarification which you would answer a yes or no to, and then a question. You are saying doctors are not beyond investigations and they do not enjoy any immunity, but the body conducting the investigation has to be the right one, which in this case should be MedCan.
Absolutely.
Okay, so my question, the issue of professional standards and negligence when it comes to the health sector abound, and no one can deny that. I'm sure even yourself can't. But how do patients seek redress, and what channels are open to them? And I think the question on a lot of people's mind is, why is this even so? What is responsible for the substandard and the negligence we see in our health sector?
Well, I will first agree with you that there is substandard service within the health sector in Nigeria. The truth of the matter is that every day patients go to the hospital. Every day, what you will otherwise call miracles are happening. Every day, people that are effectively blind are seeing when cataract is removed. But the only thing is that the few times when something goes wrong or when the outcome is not the expected outcome, which happens from time to time, that is usually used to typify what happens in the hospital. If that is the case, all of us will be dead. So that is not the case. But having said that, I must say that that does not mean that for every system there are either deliberate bad eggs or people practicing beyond their training and their capabilities. And sometimes they may do something wrong, which is preventable, which is avoidable. And within that, they hold the patient a duty of care. And if you don't have the requisite experience to do what you are doing or equipment to do what you are doing, you have breached that duty, and then you can be punished for that. But then, when you have reasons to believe that the outcome of your healthcare is not, must have been due to some negligent act, the appropriate channel is the Medical and Dental Council of Nigeria. If you go to their website, you will see the process of making the report. Granted that I believe that personal opinion is that the deluge of kind of petitions to the tribunal may have made the tribunal busy. I personally thought that the tribunal should have state jurisdictions where we'll have more tribunals at the state rather than at the central level in Abuja, so that more people can table their grievances and get redress if there is any form of negligence early. But having said that, it's not because of lack of regulation. And don't also forget that while Medical and Dental Council of Nigeria is there are also agencies within the health sector. For instance, in Lagos State, we have the EFAMA, which is the Health Care Facility Monitoring and I think Accreditation Agency. Before a facility will be established, they want to know what is on ground. They don't want to know both human and material resources. They want to look at the environment before they license you. And I'm aware that they actually visited Premier Hospital after this unfortunate incident. And the investigation is still going on by people who have the legal and human resource to do such investigation, because the head of a pharma is a medical doctor and is populated by medical doctors who understand the issues in healthcare, who understand the nuances. We are not going to just commodify healthcare into it's a good and service, and that if it is not properly done, well, any agency can look into it. It doesn't work that way. So there are agencies, and I'm aware also, because I saw it at the website of a pharma this morning, that the intensive care unit of Premier Hospital was temporarily closed while they want to determine whether there might be issues with the facility there in terms of support of life in the time when intensive care is needed. That is a responsive agency taking action within the ambit of the law and within their calling.
Okay. Dr. Atilola, I appreciate that you may be a little protective of the body you represent. And well, you should be, because you're doing life-saving work every day. But do you also appreciate why the family of the deceased, because we saw the husband of Peju Ugboma present there and participating in that public inquiry, would want to pursue this on several fronts? So he's looking forward to hearing the outcome of MedCan, as well as on this front as well. And why the public do need to see some kind of public reassurance, because even though you say that then few cases, the experience of many would suggest otherwise. How do we strike that balance between not putting doctors on the defensive, where they're practicing defensive medicine, and still giving public the confidence that these doctors will be held accountable where there is negligence?
Yes, so thank you. I must say that, like I mentioned earlier, we are doctors, yes, but we are human beings. And Nigerian Medical Association Lagos State branch actually paid a condolence visit to the family. And we also educated them on the proper channel to seek redress for any grievances they may have. I don't know whether there might have been some mismanagement or not in the case of the deceased. And we never said that there might not have been. What we just told them is that, look, this is how to go about it. You may want to seek redress from multiple sources, but you must be mindful of the fact that there are sources that when you want to use them, the people involved may be forced to also stand up to defend themselves that, no, I'm not going to be getting myself carried around from one agency to the other. And in the process of doing that, the truth of the matter is that the aggrieved will be getting angry. And that is not good for mental health. My own perspective is that when you want to pursue a matter, I believe in the pursuit of redress when you think you are aggrieved. I've done that before for other reasons. But what we are saying is that let it be through the appropriate panel. Now, I've also said that I recognize, and this is my personal opinion, that there are issues within our own regulatory system also that we need to address. For instance, I mentioned the issue of the fact that I feel that rather than have a central jurisdiction in Abuja, we can have regional jurisdictions, we can have state jurisdictions, because I don't believe that if there is an alleged malpractice, medical malpractice in Abeokuta, and the doctor is in Abeokuta, and the patient is in Abeokuta, the patient that alleged that malpractice has happened, I don't see a reason why the two of them should join to board a plane and move to Abuja to go and discuss it. In the eye of the public of Abeokuta, they may not see that justice is being done. But if we are sitting right in Abeokuta, where the people of Abeokuta who are aware of the allegations, who are aware of the issues, can come and see within their jurisdiction that this issue is being addressed, and this issue is being taken. Okay, so also because of the confidential nature and the peculiar nature of healthcare, we may not have the opportunity of being on the big screen, like inviting media houses, come and cover the entire proceedings and all of that. So sometimes, because of those limitations, people believe that nothing is being done, whereas a lot may be ongoing in between. There is a reason why doctors are not allowed to advertise on TV. For that same reason that you are not allowed to advertise, because it's supposed to be a very noble, serious-minded profession, not something you go on TV and start shouting that, look, if you come to my hospital, pregnant women are delivering with ease. No. So for the same reason, when we want to examine when issues are wrong, we sit down in the very most solemn and most noble gathering where we have a very solemn and noble conversation, and not a conversation for the media. But then, having said all of that, I believe that within those framework, there might be need for us to also come out a bit more, engage a bit more with the public, engage a bit more with consumers, hold more conferences around the issue of consumer protection within the health sector. I agree completely, and I feel that those are areas that the Nigerian Medical Association and the Medical and Dental Council of Nigeria need to start looking into, so that we won't be having encroachments on what is ordinarily within our purview.
Indeed. Let me ask you, and if you can help us understand, you agree that the FCCPC, it's a mouthful, the Consumer Protection Commission, does have a duty when it comes to consumer rights protection. You agree to that extent. But you say on this front, they have dabbled to a territory that is not theirs.
Yes,
if they were to establish a violation of consumer rights, in these two cases of Peju and I think it's Yetunde in Ogun State, what would be the violation, considering that these two patients unfortunately lost their lives?
Okay, see, there is one beautiful example I always try to give. If you board a plane and the plane is involved in a crash, people will die, and they are not going to die in few digits. They are going to die in tens, if not hundreds. So that is a major calamity. There is an accident and investigation bureau in this country whose responsibility is to first investigate what happened. Is there a negligence on the part of the airline? When that negligence is established, then a consumer protection agency can conceive a breach of consumer rights there. That is the point we are making to FCCPC. First, allow the people that are empowered to understand the intricacies of medicine to establish that in the death of this deceased, there is a malpractice. there is a negligence, there is some kind of tardiness in your handling of the case, easily any other agency can now say, okay, having said that, that can even serve as evidence in court. When people seek civil redress, compensation for medical error, they don't go to the court trying to go and argue the medical error there. The easiest thing is to collect the proceedings of the Medical and Dental Council, or the resolution, or the outcome of the Medical and Dental Practitioner Tribunal as an evidence in a court to say that this has been established. Now I want to seek redress. Because the only thing that is available to FCCPC now is whether to ask questions about whether surgery was paid for. And was surgery done? The answer is yes. What is in contention is the outcome of that surgery. And the outcome of that surgery needs to be determined, because part of the outcome of surgery could be death, naturally. Not because of anybody's error. When you go in for surgery, each time you board a plane, you run a risk of dying if the plane crashes. If you go in for surgery, you run a risk of death. However, we want to determine whether it is because of a natural risk of something you did incorrectly.
So much. And quick correction, the young lady who died in Ogun State is Omolara Omoya Jowo. And then, of course, Peju Ugboma here at the Premier Hospital in Lagos. But thank you so much, Doctor, for shedding light on this incident with us on Newsday. Much appreciated.